Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. I'm joined by Lanette Siragusa, Chief Nursing Officer for Shared Health. Today we're announcing 11 additional deaths due to COVID-19. A female in her 50s from Southern Health Santé Sud, a male in his 60s from the Winnipeg Health Region, a male in his 70s from Interlake Eastern Region, male in his 70s from the Interlake Eastern Region, a male in his 80s from Southern Health Santé Sud, a male in his 80s from Southern Health Santé Sud, a male in his 80s from the Winnipeg Health Region linked to an outbreak at Golden Lynx Lodge, a male in his 80s from the Winnipeg region also linked to the Golden Lynx Lodge, a female in her 80s from the Prairie Mountain Health Region, a male in his 90s from the Winnipeg region, and a female in her 90s from the Winnipeg region linked to the outbreak at Golden Lynx Lodge. We'd like to express our condolences to their family and loved ones. The current 5-day test positivity rate is 14.2% provincially, 13.8% in Winnipeg. We've had 400 new cases identified as of 9:30 a.m. One was a duplicate, so we have 399 net new cases to report, taking our total number of cases to 12,007. I've been made aware that someone is making calls to various businesses claiming that they are me and telling them that they must close due to public health orders. I am certainly not calling businesses and telling them anything of this nature. So if you do receive calls like this, you can call the health links if you have further information. I think our message needs to remain clear. Our numbers are going in the wrong direction. We cannot sustain these numbers in our healthcare system. We need to bring these numbers down, and our message on how to do that is clear. The answer is clear, and that's to stay home. Stay home and socialize only with members of your household, leaving your house only for essential reasons. This includes any non-essential travel, including going to the cottage. Really, that message is clear, is just to stay home. We need to get on top of this virus in these next couple of weeks, and the best way to accomplish that is just for us to stay home, leaving only for essential reasons. This, of course, includes Black Friday shopping sales. We know of a bunch of advertisements appealing to people with big savings. Certainly take advantage, if you will, online or curbside pickup, but people should only be leaving their house for essential reasons, and Black Friday sales are not included in that list. It's really just each time you're leaving your house, is it absolutely necessary, or can it be accomplished another way or accomplished in a couple of weeks from now? We need Manitobans to do their part. We need businesses as part of Manitoba to do their part. And to remind Manitobans, including businesses, that we have frontline healthcare workers at risk with the increased test positivity. We have our vulnerable groups in Manitoba that are at risk. We're announcing deaths every day, and so everyone can do their part and reduce contacts, and that is to, for the most part, stay home. In stores, public health orders currently require a 25% limit on that capacity, and that should be very closely monitored. We don't have any reason for crowding right now, to do whatever we can to limit that. And again, people shouldn't be in these stores for non-essential purposes. So there's no reason that these stores should be crowded right now. And we are definitely getting that message to businesses that we expect very tight adherence to these public health orders, or we will be required to find other ways to ensure that Manitobans are going to be safe. We have been announcing concerning numbers. We announce every day about the capacity of our healthcare system. You hear me send my condolences to families every day now. So these are very daunting times for Manitobans, but again, that message is we have a clear path forward. We know exactly what we can do to bring these numbers down. And in public health, we're appealing to you. You hear the appeals from our healthcare providers on the front lines to stay home. Limit your socialization to only your household. Limit the need to leave your house except for essential purposes. With that, if everyone on board, we can really bring down these numbers and then hopefully get back to these these things that we love. So again, the message, stay home. We're going to get through this together. And so thanks for everyone who's stepped up, and thanks to everyone who's now stepping up. And I'll pass it over to Lanette.
Good afternoon, everyone. Our healthcare system continues to expand to meet the increased needs of the COVID-related hospitalizations. We have 102 beds now open in critical care across the province. As of midnight, 88 of those 102 beds were in use, and 50% of the ICU population is now COVID-19 positive. 38 of the 77 patients who are on ventilators this morning are also COVID positive patients. To staff these additional beds within the system and meet the increased hospitalizations, we are relying on staff and physicians who normally work in other areas to support these high demand areas. Our staff who normally work in inpatient surgery are now being redeployed to work on medicine units. Our operating room, recovery room, and preoperative clinic staff are being redeployed to other areas as well, oftentimes critical care, where some of them have worked before or have some familiarization. They are getting trained and orientated and supported when they go to these new areas and work with new teams. It's disruptive for our staff. It's also really disruptive for our other patients, namely our surgical patients. To date, we have canceled 771 elective and non-urgent surgeries since October 26th. And we just want to acknowledge how hard that is for people who need a surgery and have to wait for that. So we apologize, and it's not ideal. It's not something we want to do, but it is something that we have to do in the midst of this situation. I also want to provide an update for what's happening in Bethesda Regional Health Center in Steinbach. We continue to appreciate all the efforts of the clinical and support staff, as well as the site and regional leadership. There's been a lot of activity there, as everyone knows, and these are not ideal circumstances. The situation continues to be challenging, but they are managing locally, and whenever possible, whenever they need clinical teams and other facilities throughout the province will help out and support as required. The region reports that the emergency department at Bethesda has seen now a more stable volume over the past couple of days. And while patient flow continues to have its challenges, the support from other hospitals in surrounding areas within Southern Health Sante Sud has been very helpful. So thanks to all who've heeded the call. There still are challenges related to staffing, but it has improved over the weekend, and this is thanks to reassignment of staff from other areas, including Bethesda's surgical staff who've been redeployed. There also, I wanted to give an outbreak on the outbreaks that are happening. It's unfortunate, but outbreaks in healthcare facilities are reality, a sad reality in our situation. It's something we will continue to manage, but as long as community transmission remains, it's always going to be challenging for us. When an outbreak happens in a facility, we trigger enhanced infection prevention and control measures. We make sure we notify the staff, the patients, and the families. We restrict patient movements and sometimes have to restrict visitors, and do widespread testing and monitoring of symptoms and complete contact tracing. So all that happens in an outbreak situation with the effort to lower the risk of infection and spread within the hospital or the facility. Since we last spoke on Monday, an outbreak has been declared at a third unit at the Health Sciences Center. The unit is GA3, where 2 patients have contracted the virus. In total, 29 patients and 23 staff have tested positive for COVID as part of the 3 outbreaks happening at Health Sciences Center. 2 patients have sadly passed away. Update on our alternative isolation accommodation program. It continues to be extremely busy with these high volumes. In total, we have 214 rooms available for use throughout the province. And as of yesterday, we had 144 people that were using the isolation program. This includes 23 people who were using the federal site that is supported by the Red Cross, as well as 26 individuals who are accessing isolation space in the north, in the northern communities. We have 56 people who are isolating at our local hotel. And then we have a few options for the shelter site for those who may be experiencing homelessness. So there is a shelter site, the primary shelter site in Winnipeg is near capacity, and it has been for the past 2 weeks, and that has 39 spaces available. We also now have a second shelter site, which has 22 spaces, which is also near capacity. And then we also will be developing a third shelter space with 140 rooms, which will open in the next week in order to meet the increasing demand. Our plan is to use one of the 3 shelter sites for those who are waiting for test results and who may move within a couple of days to ensure that there's flow and capacity for the daily demands. The other 2 shelter sites will be for COVID positive clients, and we see this volume increasing daily. Another update for you. We have been working really hard to make sure that we make it easy for our healthcare workers to come to work, and we want to speed up the process for staff who need to be tested and get their results sooner. And assuming that they're negative, then have them show up to work in a timely way where we are desperate for them to be. So we will be opening a dedicated testing site for healthcare workers and first responders at the Winnipeg Fire Paramedic Services Training Academy, which is on 2546 McPhillips Street. This is a drive-up facility by appointment. On-site staff will be licensed paramedics who are currently not working in the field. So they'll be managing the swabbing and the patient flow there. The site will be open this Friday, and its hours of operations will be Monday to Friday, 7:30 till 3:30. And additionally, we will be holding a limited number of spaces for appointments for essential service workers at our Pembina Highway and St. Mary's Road location. Healthcare workers and first responders needing a COVID-19 test can book an appointment by calling this number, 1-855-268-4318. And individuals will need to show their professional identification at the site to keep their pre-booked appointment. And then lastly, I just want to announce that Winnipeg home care services are being adjusted. Staff who work in the community within home care have stepped up over the weekend to provide assistance in the long-term care sector. So home care levels as a result will be adjusted to the similar service levels that we had over the springtime. So any and all clients who require life-sustaining services or anyone who's in need of urgent services through home care will continue to receive those services. The effort is part of our ongoing planning and prioritization to ensure that our healthcare workers are deployed to the areas of greatest need. We are very grateful to all the staff who continue to show great dedication and flexibility and commitment to the patients, the residents, and the clients that we serve. We very much are looking forward to getting through this and getting back to normal levels of service for all of the public. But for now, we appreciate your patience, and we'll keep going as best we can. With that, we will open the line to questions.
Thank you. A reminder to our reporters on the line this afternoon, you will have one preliminary and one follow-up question. Up first this afternoon from CBC Manitoba, Bart.
Hi, folks. This $298 dedicated fine for not wearing a mask that's announced in the press release, what kinds of places will that involve? I mean, obviously a retail store, but what about in a gas station outside? Can you elaborate on where people, Dr. Roussin, will get that $298 fine if they fail to wear a mask?
So it's only those places where you're mandated under the public health order. So those are indoor public places. So everywhere that's listed. So outdoor, we don't have a mandate to wear masks. So indoor public places, those not wearing masks could be subject to a fine.
Okay, this is going to sound familiar, but at the beginning, it was towards the beginning of October, you announced the indoor and outdoor mask mandate, but you're telling me right now that mandate is really only for indoors.
The mandate in the public health orders are indoor public places. In Prairie Mountain Health, when we went to Orange, because of the epidemiology there, we actually had indoor and outdoor public use of masks. But in the orders now, it's indoor public places.
From the Canadian Press, Steve.
Dr. Roussin, this mask mandate, obviously there are more people out enforcing it. It's $298. I imagine, am I correct in assuming that it'll work like a ticket? Somebody in enforcement sees you and you're handed a ticket and you then decide to pay it or fight it like other tickets. Is that correct?
Correct. Yeah, but we have the ability to have that immediate enforcement on it.
Okay, and I know I asked you this before, but I'm going to ask it again today, given today's numbers. We're still seeing high numbers in Winnipeg, and this is, a few weeks after the first round of restrictions were brought in, and now we're, a few days into the even stricter restrictions. Were you hoping to see numbers drop by now in the Winnipeg region?
Well, certainly if we frame it as hoping, yes, we want to see those numbers drop as quick and as dramatic as possible. With the increased red restriction, we're just, creeping up on a week now. And so it's probably a little early to see the benefits of that. But certainly with the other, even with the orange restrictions, we were anticipating better numbers. And that's why we had to incrementally keep increasing it.
From CTV Winnipeg, Michelle.
Hi, I'm wondering if you think the spread of disinformation online is leading to the choices that Manitobans are making given their behavior.
I think misinformation is a real negative thing right now in a lot of areas, including COVID. And so I think there's big work out there trying to convince people that this just isn't important. And I don't know necessarily what the motivations are from that these are individuals who feel they're just not really at risk, so they don't really perceive the risk that way. But we're trying to get that message out to Manitobans. I think it's very clear that our hospitals are reaching capacity. We continue to have to expand our ICU capacity, and we won't be able to do that forever. We need to change these numbers. So we're announcing, deaths all the time. We see outbreaks in personal care homes. We see outbreaks in hospitals, and we see our numbers just trending in the wrong direction. So really follow that credible information. We all know that it would be great if COVID just wasn't as severe as it is. It would be great if by just ignoring it, we'd all be okay. But it's quite clear, it should be quite obvious that that's not the case. We're in this pandemic. We're going to be in it for a while. We need to decrease the transmission of this virus.
Okay, my second question is about the home care changes. Which staff are being redeployed? Is it personal care aides, or is it nurses, or is it both?
I think it would be open to both, and it would be dependent on the needs of the clients in the home. So they'll make those strategic decisions based on who needs to shift to the personal care home and whose services can be adapted in home care.
From City News, Jonas.
Good afternoon, folks. Ms. Siragusa, first question for you today. When it comes to expanding ICU beds, I believe this is now, if my math is correct, about 30 additional beds since the update you gave us about 10, 14 days ago. Can you just talk about the efforts that have been underway to expand capacity in this time?
Yeah, so it's a bit of an iterative process. So early on, in the spring actually, we identified where the spaces could be for critical care. And critical care beds are not the same as general use medicine or surgery beds. You need more space because you have more monitors. You need oxygen, suction, medical gas available. So it's not always easy to identify spaces, but those spaces were identified. The equipment, the supplies have all been purchased and are waiting to expand. And as we've discussed in the last couple of weeks, the staffing models have also been identified and now starting to be implemented, where we will pull nurses and other healthcare professionals and support staff as we need to build these beds, as we need to build this capacity. So, and it is really important that the critical care team themselves, the medical leadership and the clinical leadership, they meet every day and they talk about who's coming in, where's the best place for them, who's transferring out, and they work together. So between the Grace, HSE, St. Boniface, and Brandon, those conversations happen so that they can really have an integrated approach and coordinate the care that people need.
Thank you for that. Dr. Roussin, again, this message about Black Friday businesses, I guess directly, like if we get into Black Friday and the doors are open, are we thinking retroactive fines for businesses that are not obeying, or I guess where's the idea there from public health's perspective?
Well, I mean, we have orders in place right now that, require non-critical businesses to be closed and strict capacity limits. So those are in place right now. And so anyone who is not living up to that it could face enforcement. So definitely that message is clear. And at the same time, we're looking at ways of perhaps having the orders even more clear onto what exactly is critical and what should be sold. So we're reviewing some options right now, but we have very strict orders in place right now, and we expect them to be followed. And if not, businesses will face enforcement.
From CHVN, Taylor.
Hi, good afternoon. And we're seeing some surveys coming out of school divisions asking about remote learning, and it's sounding like students could be going to this method. When would this happen and how long?
Well, we don't have any definitive answers on that. We've, that type of remote learning has been in the pandemic response plan for quite some time, and so as far as details on that, we can discuss with education. We've discussed different things that we're looking at in our jurisdiction and other jurisdictions on whether we extend that holiday break and what that looks like, but we don't have any definitive plans at this point.
And some people believe the reason for the high number of cases is due to PCH and hospital outbreaks. Now, outside of these facilities, what is the reality of community transmission right now?
Yeah, and so it's community transmission that's driving the pandemic. Certainly in those areas, hospitals and PCHs is where we see a lot of the severe outcomes, because this is very vulnerable settings. But it's community-based transmission that's driving it. We've had well over 500 cases in the last 7 days that are just community-based transmission, meaning we can't link them to anything. And you can see that test positivity rate is over 13%.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon. Dr. Roussin, when an outbreak is declared at a personal care home, why are residents and staff who are not showing symptoms of COVID-19 not tested proactively for the virus? Why wait for symptoms to develop when some cases can be caught through asymptomatic testing?
Yeah, and so there's a couple things. So that is taken in certain circumstances, but just like any intervention, we need to be able to, it has to change what we do. So when we declare an outbreak, all residents will be isolated in their room. And even before then, we have universal PPE use. So if a resident is isolated in their room, if they test positive or negative, it doesn't change what we do. They'll still be isolated in their room. And so there's certain things with staff, there's certain circumstances where we may have to cohort patients if that's necessary, then we do undertake some asymptomatic testing. But just to do widespread asymptomatic testing just every time on everyone doesn't necessarily change what we do.
Thank you. And then I was also just wondering, so other provinces, including Ontario, conduct routine asymptomatic surveillance testing of long-term care home staff. So in Ontario, it's about twice a month for long-term care home staff. Is Manitoba planning to introduce this measure, and why or why not?
Yeah, and so it's the same type of deal. We have a lot of things in place that we really want to decrease the importation of the virus into these settings. So first and foremost is the screening for symptoms and the universal PPE. And so that should provide a great deal of protection to residents. In addition to that, surveillance screening is a certainly option. If you look at the actual yield of that, how many tests have to be done to to find anyone, and that person should have been wearing universal PPE anyway. So it is that balance. So just like any of the different approaches to it, we never exclude anything. Right now, we have, our testing capacity is being reached a lot of times. And so this is just yet another thing that we are looking at. But like I say, we have a number of safety mechanisms in place right now to ensure that we're trying to limit the importation of that virus into those high-risk settings.
From Global, Brittany.
Good afternoon, Brittany from Global News. Dr. Roussin, we're hearing a lot about vaccines lately with both Pfizer and Moderna's vaccines saying that they should be scheduled to be ready soon. We've already heard from Ontario's health minister their plans. What kind of plans were happening here behind the scenes in Manitoba and for distribution, and how much vaccine we might be able to get?
Yeah, and so we were definitely planning to receive vaccine as early as January. That's the plan. And so that's what we have to plan for. We don't know when or how much we're going to receive, but we are planning as if we did receive it there, we'd be definitely ready. And so we're working with our federal partners and a special advisory committee to find that those priority groups on who would be eligible. We're looking at where we're going to receive the samples in different regions, and then how we would, get it to the initial high-risk people. And so I think we should look at the vaccine with optimism. But again, it's not going to be that early fix to the pandemic. Early signs show that they're safe and effective, but there's certainly going to be low quantity at the beginning of next year. So we're going to be dealing with this virus for many more months, another year. But it certainly is optimistic results that we're seeing with these vaccines, and we're going to be prepared, should we receive one in January, to be able to distribute that.
Thank you. And I know we've talked to you a lot over the past few days about stores and essential goods and who can stay open, and you talked about strengthening those orders. Who has the authority to mandate stores to just sell essentials? Or how do you write that into an order when we talk about small businesses that may have been skirting around the rules and been buying, small amounts of an essential item to stay open? How do you put a mandate in for that? And who has the authority to tell a store they can or cannot sell something?
The Public Health Act has the ability to do that. So we could issue an order under Section 67 of the Public Health Act that could list what we determine to be essential goods, and only those goods would be able to be sold. So we haven't landed on that approach yet, but it's certainly feasible under the Public Health Act.
From the Brandon Sun, Michelle.
Yes, hello. Good afternoon. My first question is regards to Prairie Mountain Health Region, and whether, if we're able to get our numbers down here, as we did once before, would you consider moving the area into orange, even if the rest of the province remains at a high case count? Or is the plan now to continue taking a whole province approach?
Yeah, I mean, I think nothing would be off the table. We'd certainly look at the region and see what the epidemiology shows. We have to balance that with what's going on around it. I think right now the focus that we have is that we're seeing that strain on our healthcare system, and so we have to really do whatever we can to get the numbers down, to remove that strain from the healthcare system, and then we could, then we would look at things on lifting it, whether it be in region specific or province wide. So it really depends, but I would say that our clear focus right now is to get these numbers down to relieve the strain off the healthcare system. And so once we see that happening, we can look at our options.
Okay, thank you. And Lanette, you spoke of home care, and I just happen to have an email here from the NDP stating that vacancy rates for home care workers in the Prairie Mountain Health Region is 25%. So I'm wondering what efforts are being made to fill those vacancies.
Well, I haven't, I would have to speak with Prairie Mountain Health leadership as to what specific strategies they have employed so far. But I will tell you, as part of the response to COVID, we are looking at how we can recruit and train and deploy more people within the community and long-term care sector. So we would have to defer that question specifically to Prairie Mountain Health leadership, but more info coming hopefully soon.
From CJOB, Will.
Good afternoon, everyone. Ms. Siragusa, based on your opening statement there, it sounds like the situation at Bethesda is a bit more stable than days ago. I'm just wondering what happens next, as in, are you still adjusting spaces? Are you still bringing in more staff? Where do you go from here?
Yeah, it's interesting what's happening at Bethesda because they were so busy over the weekend. Certainly the leadership needs to stay on top of it, and I know they will, looking at with the positivity rates happening throughout the province, but the activity that's happening in Steinbach, what impact does that have for them? Also really listening to the staff who's working in the hospital, if there are specific needs or opportunities for improvements. Specifically right now, they're looking at reorganizing the weight room so that there's a COVID area, a red area, and a non-COVID area, just to do everything they can to manage the flow and keep everyone safe. And so we'll have to see what happens. I mean, it's a pandemic we've never been in before, and what's happening in Steinbach isn't necessarily reflective of what's happening in all the emergency departments throughout the province. So we'll have to see if that was a blip or if that is an ongoing trend that we're going to have to manage longer term.
Okay, thank you for that. Second question for Dr. Roussin. Doctor, at the beginning of September, the Canadian Medical Association Journal wrote that until that time, children had been underrepresented in COVID case counts. So I'd just like to know, what sort of evidence would you need to see before any further restrictions or perhaps a heavier shift to remote learning might be considered?
Yeah, so there's a couple of things. So one is as obvious as if we start seeing a lot of transmission within schools, if the school setting becomes riskier. And so we've seen a lot of cases in children of school age. We're just not seeing a lot of transmission within that setting. So that's is one thing that's allowing us to keep the schools going. The other thing is just simply the rising community transmission. Eventually that could get to if that got to a number that was was so large, and we don't have a specific number for that, that it's just becoming untenable to deal with the community acquired cases within schools. That could lead us to think of things as well. But right now we're just not seeing that transmission, and so. We all know how important it is to keep the kids in school, and so for now we're able to do that.
From the Winnipeg Sun, Scott.
Good afternoon to both of you. I'm going to pick up on that question I was just asked about schools. So some other jurisdictions have closed schools at 3% test positivity rate. We're at 5 times that, or roughly 5 times that. Why wouldn't that be viewed as putting lives at risk? And if you can't say a number for test positive, I mean, we're at a very high test positivity rate. Why aren't schools? And I know there's benefits, but why aren't schools being closed as more of a life-saving, I guess, measure than anything else?
Yeah, I mean, the simple answer is we're not seeing transmission there. Right, so all of our public health orders, all of our, the things that we're doing here is to limit the amount of transmission. And so right now, you're right, we have a very high test positivity rate, and we need to get that down. But despite that, we're not seeing a lot of transmission within schools. And so balance that with the importance of it. We're not going to rush into, going to full-time remote learning. We know that's an option, and it's been an option right when we started thinking about getting the kids back in school. We had options in place for that should they be required.
Thanks for that. And I guess if you can mandate who can sell what and that sort of thing, why not just mandate closures on Black Friday for anything but essential businesses like grocery stores and pharmacies and that sort? Why not just shut those other stores, like let's say, for instance, a Best Buy who's only selling TVs and other, electronic stuff, and maybe appliances. But why not just mandate those stores to be closed on Black Friday, just eradicate the problem before there is one?
Well, the thing is that some of these stores, that's how we got into the problem. Is some of the stores are selling what we could define as critical items, and then that's leading them to be open to selling all of their items, and that's really where we're trying to work on. Is that one, we're encouraging businesses, follow the spirit of the order, right? The spirit of this order is one thing, for Manitobans to stay home. All right, so if you're encouraging Manitobans to come out and shop for non-essential items, you're not following the intent of our orders. And the intent of our orders is to save Manitobans' lives. So we're trying to get that message out to businesses, period. And then we're going to look at ways that we can shore up those orders to try to, to try to ensure that spirit is being followed. We tried to just strongly message how important this is to Manitobans' lives. That sure didn't work last weekend, and so we're gonna find ways to make it work.
Thank you.
From the Globe and Mail, Shannon.
Good afternoon to both of you. I want to return to Bethesda, and I'm not sure who's best suited to answer this, but my understanding is that Bethesda is a designated COVID treatment center, and I wanted to know what went into the thought process of designating Bethesda as a center for COVID treatment, given it has no ICU, and why there wasn't a decision in advance of the second wave to expand capacity at the hospital to include an ICU, given what we know about COVID-19.
I can take a crack at that. So it's not so much that Bethesda was identified as a COVID unit or a COVID site. There are 3 hospitals in Southern Health that treat higher acuity patients. So that includes Boundary Trails, Portage, and Steinbach. So when a patient with COVID requires higher acuity care, they would go to any of those hospitals. Obviously, they don't have an ICU, but they do have step-down capacity, and the process has always been that if someone does require critical care or a different level of service than Bethesda can provide, then there's consultation that happens, and we arrange for transport. So it wasn't designated a COVID site, and there's a gap with critical care space being available. We're working with what we have and with the partnerships and processes that we've always used, and trying to really make sure that it's a streamlined process so that patients can get timely access to care and the right level of care that they require.
Sure, thank you for that. And for my second question, also about Bethesda, I know there's just been some additional staffing approved there, including, I believe, an additional 8 hours of emergency physician coverage, an additional hospitalist. But I'm still hearing from staff that they're short on really basic items there, like IV pumps. Even commodes have to be shared between several patients. I'm just wondering why we're seeing, these approvals and some of these things now 8 months in after a weekend of treating, triaging patients outside the hospital. How was this not addressed prior to the second wave, that there would be a need for additional staffing at a regional health center?
Yeah, it's staffing is a bit of an iterative process. So as the patients come, then the staffing needs increase. So what I would say is that they are working. There are people who are coming from different units within the hospital to support. So not every unit in the hospital may be as busy as, say, their emergency department or their medicine units. So there's an opportunity to redeploy staff where they need to go within the hospital, but also the surrounding areas are also being asked, and this is no different in Winnipeg as well, is that as the situation changes, we have to be nimble and adaptive and shift the resources where we need to go. Your question about the actual supplies, like the commodes and the IV pumps, what I would say is that if there are any shortages like that of any kind, then those need to be escalated by the staff to the leadership, either at the site or the region, and they will do everything they can to, again, just like the staff, they need to shift what needs to be there given the high volumes.
From the Winnipeg Free Press, Dan.
Hi there, Dr. Roussin. I just wanted to follow up on, because both you and the Premier have made references to the consideration of additional or clearer rules on what can be open and what cannot be open. And there's been a lot of input from particularly the small business community about fairness. But I'm just wondering, do you think that in a way the voices from outside are asking you to actually start to do an assessment on a business by business basis of what can be open? And does your office or the pandemic response infrastructure have the resources and the capacity to start doing business by business assessments of what should be allowed to be open, what shouldn't be allowed to be open, and what should be sold if they're open?
Yeah, and so the approach that we would take is to, or one such approach is to ensure only the sale of critical items and provide that list. So public health capacity wouldn't be utilized right now to go business by business. Looking at that, we would a lot of the orders that we have in place now, we're using the same language that we did in the spring. Yet there's many more businesses that are open now, and so again, it's the spirit of those orders. We explained to Manitobans why we needed them, and we just haven't got got people on board with the very important need for Manitoba to stay home. So we're going to really work on ways that we can feasibly get more places either closed or selling less of the non-essential things, because we really need Manitoba to stay home right now.
Just as a follow-up, there's been a pretty keen focus on retail because it's very visible. But business, actually, if you think of it in a broader sense, really encompasses a lot more. You have, businesses, employers who have remained open, have people coming into their offices, and back office or back of the house operations for retail and food services that have remained open, but only for curbside. So I'm going to ask you one more question in two parts. Number one is, should it be mandatory for people to wear masks when they're working in offices and back office or back of the house operations? And can you tell me, when you go to your office, which I'm sure you share with a lot of people, do you wear your mask all the time when you're in your office?
Yeah, and so I think that right now the mask mandate applies to to indoor public places that are public facing. So the mask mandate may not apply to that. I would encourage employers and everyone out there we all have to do whatever we can to decrease this transmission. So we should be thinking about that physical distancing. We should be wearing masks when we indoor public places, indoor places whenever you can. And certainly no one who is having any symptoms of illness should be at work and out and encourage employers to look for ways for people to work at home. So, these are, we can't let our guard down. We know we need some, essential services open. We know we need to have some things going so we still have businesses operating, but we have to limit the interface with the public, and we should be looking at ways to decrease the risk of transmission within the workplace. For myself, while sitting at my desk, I won't be wearing a mask. If I'm out and about within the building, I'll usually have a mask on for that.
From CBC Radio Canada, Laisa.
Thank you. My first question will be for the chief nursing. What is the situation in small hospital in Southern Health Southeast, specifically talking about St. Anne? How many COVID patients do we have in that hospital, and what is the state of resources?
Yeah, so St. Anne's is very close to Bethesda, as you probably know. So my understanding is that they're not in the same intense situation as Steinbach, at least the last report that I received. I don't know exactly how many patients right now are in St. Anne's, if any. But it can be a fluid situation. So a patient may be there, but if their acuity needs dictate, they may be able to be discharged home, or they may need to go to a higher acuity site. So that's always changing. But as far as I know, I haven't heard any major concerns coming out of St. Anne's related to staffing or just that big surge that we're seeing next door in Bethesda.
And my mentioning the possibility of extending Christmas holidays, I just want to know, do you have any deadline where you will provide information about that possibility? And also, what are the options that you are working on now? Extending, would that mean 2 weeks, 2 more weeks without school, no studying, like holiday even for teachers?
Yeah, so we don't have any clear dates on that yet. These are things that we're discussing, here with the Department of Education. I'm discussing with my colleagues throughout Canada through the Special Advisory Committee on just certain options and what the benefits might be. And so I don't have any specifics to address, and the timeline. I don't have a specific deadline on that. We're following things here and looking to other jurisdictions as well to see what next steps they'll take.
Thank you. We have time for just a couple more questions. Please proceed.
Dr. Roussin,
Hey, Dr. Roussin, Bartley here.
With the new mask sign that's in place here, what about people that previously have had medical conditions or have been exempt? Are they going to need to be wearing some sort of face shield or something different? Or how's that sign going to work?
Yeah, the medical exemptions or the exemptions that are listed in the order will still apply. And so there'll be a reasonable expectation that a person can demonstrate that they require an exemption.
Dr. Roussin, what do you make of the fact that schools don't appear to be contact tracing much? Not all schools have stopped, but some schools aren't getting within 2 weeks. What do you make of that?
No, we haven't stopped contact tracing within schools. So there's a couple things which may be going on there. Is that again, the contact tracing only applies to close contacts. So when a case is diagnosed that it was infectious during school time, a letter will go out to the school community and letting them know that. Public health works along with the school to determine whether there was close contacts. Those close contacts would be notified and followed up by public health. But oftentimes the process in schools are good with masks, with distancing, that we don't find close contacts. And so that might give people the perception that contact tracing hasn't been done, but it has been done. It's just that those particular people weren't determined to be close contacts.
Hi,
Hi, Dr. Roussin.
My question
I'm wondering, I've heard reports.
It's just a quick question. Nurse Siragusa, with the restrictions on personal care home admissions, how is that impacting hospital capacity right now? That when so many Winnipeg homes have outbreaks and they can't admit new admissions?
For the not admitting into the personal care homes. Yeah, it's something we're continuing to watch. It could have impacts for sure on patient flow, but right now we're okay, but we will have to watch that.
So my question follows up on a couple of other questions related to schools. I'm wondering, what is the protocol for a teacher who tests positive? I've heard reports that school staff who do test positive are told not to divulge the information until the province announces it or it okays a letter being sent out. That lag time seems concerning, so maybe you could clarify that a little bit.
Yeah, and so we are getting a bit more of a clear process on that. So what happens is, people might find their test positive online, and that gets referred out to public health, and it's, depending on it, might get to public health that same day or later on in that day or sometimes the next day. So some people have in their hands a positive test result. And are waiting for public health to reach them. So we're working with schools right now to have a toolkit to be able to address this little bit of a delay right away to start working on things. The problem with that is we've seen a number of times. We've seen daycares where people have tested positive. They have disclosed it. The daycare shut down. Public health gets that information hours or the day later, investigates a person wasn't even infectious. There was no need to shut anything down. So that's sometimes the trouble we run into with that. So, but we are working with education. We're going to have that toolkit in place so that we'll all know exactly how to deal with these ones and get on them right away.
Thank you, Doctor. Thank you, Nurse Siragusa. This concludes today's media briefing.